is Rambam Medical Center's director, Professor Biaer, and in a meeting devoted to the relationship between medicine, science, and technology, there is no one more fitting than he. Professor Biaer's research ranges from theoretical and analytical studies of the cardiovascular system to the development of stents and new technology in cardiology. Professor Biaer is now spearheading the ADAM project, a major development plan focusing on the combination and synergy between medicine, science, and technology for the improvement of healthcare. As a man of vision aiming at shaping the future, Professor Biaer will talk to us on modern healthcare for all, the Israeli vision for medicine. Professor Biaer, please.
I will try to really look at the models for the world through the eyes of Israel and maybe even from Rambam. I think I have my separate lecture there. Yeah, that's it. How do I advance? Space? Okay. Well, if we look at a snapshot of Israel basic healthcare information, we all know 7 and more million population, life expectancy close to the Western world of 82 and 79, a low infant mortality rate, a very low health expenditure rate, I'll look into that later on, 7.8%, low hospital beds for the country, and quite a nice number of MDs for now. If we look at life expectancy over the last almost 30 years, over 30 years, we see that we're constantly increasing as it happens in the Western world. Life expectancy increases quite a lot. If you look at what happens in 75 to 2008, it's like living at least 8 years more for each gender. It happens in Israel across populations. Jews, Muslims, Arab Christians, Jews, all have an increased rate in a decreased rate in infant mortality, not only life expectancy. You see here another very powerful indicator for health of the country. So there's a huge progress in these, I would say, indicators of health in the country. If we look at the major causes of death, a very interesting trend. Something most of you probably know that, but this is Israeli data, ICDC, the Israeli Center for Disease Control. You can see that in stroke and in heart disease, which is heart disease, the second killer in the last data, there is a decrease in the number of deaths. But in cancer, diabetes, kidney disease, there is actually an increase in mortality. This is data from ICDC. This is the same data, just shown over the years, a decrease in cardiovascular mortality for both genders over some 20, close to 20 years. Cancer, almost no decrease, as you know that. Stroke, a decrease similar to heart disease, maybe a little less. It doesn't show here on the graph, but less. In spite of that, we are paying, look how much, and this is data that we actually extracted from Rambam economic data. This is what Rambam spends. It spends twice as much, 250 million shekel a year on cancer, twice than cardiovascular, which cardiovascular is almost twice than more than twice than what we spent on stroke. We didn't look at national data, and I don't know if there are international data available, but that's very interesting. We're spending a lot on cancer, a lot of resources on cancer, and we didn't conquer at all mortality. And we all talked this morning about cancer and genetics. We're not there yet in terms of conquering the disease. A little bit about healthcare in Israel, and that's preparation also for the panels, I think, after that. We know that in Israel, for those of you who don't live here, healthcare is controlled by the sick funds, 4 major sick funds, Klalit, Maccabi, Meuchedet, Laumit. We have so much general hospitals and the ambulatory services and psychiatric hospitals. I won't get into details. There was a national insurance bill which was passed in 1995, which actually in very, I would say, bullet points, provides universal coverage, defined a basket common for everybody. There is a freedom of choice between the four healthcare providers. There's essential collections of premiums, and there is resource allocation formula for the sick funds according to the population they treat. If we look at what happens in Israel in terms of population, you see that the population is always has increased. This is prediction. Beyond 2010, you see the prediction. Maybe it's a true prediction. It's very difficult to predict, but this is where we are at the Rambam Summit. But you can see a very interesting thing. The age of the population increase. The people over 65 increases, and it's predicted to continue to increase. This has a major implication on healthcare, on the utilization of hospitals. What happened in Israel? Number of beds have dramatically decreased over the last 20 years. It is a strategic move. General beds are decreasing. Now we are in a 1.9 range, close to 2, which is very low. How does it translate to our daily life at Rambam? This is Rambam data on occupancy. 1,000-bed hospital, as you know. This is the 2006 war. We see we are low occupancy relatively because we had to close half of the hospital for a month and more. And you can see occupancy increase. Now it's 100% on the average. There are many times where we're over 100%, and that's a national problem. That's not only at Rambam. But Rambam is just an example. This results from the increase in population, decrease in number of beds, pure mathematics. What does it do to economy? This is the story here. This is the healthcare national expenditure on health. You can see in green. In green is the data from the USA. You see they're way above everybody. This is 16.2% percent of GDP in the USA in 2008. OECD average is 8.9. Israel is 7.7. But what's more, very, I think, clear is that there is actually no increase for the last 7 years in expenditure, in actually a decrease over the years. The OECD is also increasing. This trend means that the Ministry of Finance has done its work maybe too well, in controlling healthcare expenditure in Israel. Who spends the money in Israel? The sick funds, the government, the for-profit providers, and non-for-profit institutions. Who pays for that? The government budget pays for 37%. This is data from 2007. The payroll health tax, 27%. Household expenditure, 36% in 2007. I think today is even 40%. That's what I was told. So it's increasing. We see this trend here in Israel. Over the years, the household expenditure, we're paying more and more private money to get medicine in Israel. And it comes in proportion, the money that comes from government budget decreases. So this is a trend which we don't like here in Israel. How do we stand relative to the world? This is the data on percent of total expenditure on health 2006. Israel is here. 35%. USA, for comparison, is very high, 54%, we know that. But look, OECD is 27%, England is 13%. So that just gives you an example in comparison. Another important information, number of physicians. Now we are standing at 3.5. It seems like it's a very decent numbers relative to the world. You see, it's higher than the USA, it's higher than the UK. Yet, if we look with trends over time, see what happens in the other countries, Europe, USA, constantly increasing. In Israel, we are relatively high. This is the purple here. There is a huge immigration from former Soviet unions between 90. We're peaking at 3.7, but now we're constantly decreasing, and we have to do something about it to be able to educate more students, to get more doctors in the future, to change this trend downwards once immigration stops. This is the snapshot of what happens today. We are now educating some 520 medical students that were accepted to medical schools this year. That means in 7 years, we'll maybe have this number of flows. We need many more. We need at least 800, according to predictions, a year, to be able to keep up with with a number of doctors in Israel. We believe very much here at Rambam, and I'm sure that many other places, that medicine, technology, and science go hand in hand to promote medicine. There's a synergy for success with the industry around us to promote medicine. We have a very unique atmosphere here at Rambam, that you are here, that on the same campus we have hospital, Faculty of Medicine, Research Institute. In a larger circle around us we have the Technion, we have industry sites like Given Imaging that you see here, and many others. And we are also very fortunate that the science here is so strong here in this campus with Professor Chehanover Hershko being a model for many physicians here, scientists that want to achieve success in the future. We have a very strong, this is some examples of some very strong research here that seeks the biotech money to see where it's going, all the stem cell technology. Everything started here from Israel. Professor Itzkovich started the stem cell program in the world with Thompson. In the US, most of the people I asked them, nobody knows that it comes from Israel. Nobody knows that the cells that everybody talks to them, the NIH, are Israeli cells from Rambam, that Itzkovich and Thompson published the first paper on science. So this is an example of a beating heart cells from this. Another example of outstanding technology. Although it was sold to Johnson & Johnson, this was Biosense, here, not far away from Rambam, from Professor Shlomo Ben Chaim, that is used now to do, it changed electrophysiology in the world. This is maybe why, one of the reasons why biotech pharma and device ratio has changed over the years. This is the fastest growing business of J&J in medicine. Comes from Haifa. Again, I went to Hopkins and places in the world. I asked them, do you know, are you using? Yes, of course we're using that. Did you know that it comes from Haifa? Nobody knows that. So that's another story for the world to tell. Another fascinating story that is now emerging here. This is Yamanaka, who actually, from Japan, who was the first one to change somatic cells into human pluripotent iPS cells by doing a 4-gene transfer. Really an amazing technology. This is Professor Gebstein, and also Professor Bina has done it at the Technion, who was able to do the same technology here, change them into heart cells, the first thing, and be able also to produce some tissue engineering again. What will be the funding mechanism to get it to patients? How would Goldman Sachs predict what will happen to that in the future? It all depends on a huge amount of money. They talk about how much does it cost to drill to get the oil out of the ground. It costs a lot, the same amount, to feed these scientists to drill this brain power. So it's as expensive as it is to get brain power as to get oil out of the ground. This is an example of ongoing collaboration in imaging with General Electric, GE, which is here, also in Haifa. So there's a huge amount of companies in the medical field, which is part of Israel's strength in economy. And I'm saying that more and more to say that. Look at the numbers of Israeli startup companies since 1993. It's growing, continues to grow exponential rate. This is amazing. I mean, this is something that is going sometimes silently. Next week there is a Biomed conference that everybody will talk about that. Israel life science patents by country is the highest in the world. Highest in the world. This is examples that we just heard. Biosense sold to Johnson & Johnson for $500 million some years ago. Yokneam, Pilcam, which is still a company in Israel, as another model, the strong model of being here and continuing to do, and many other examples here. Two major examples. In the middle of a crisis, of an economic crisis, just 1 year ago, two big companies out of Israel are paid millions of dollars to be paid. Mediguide from Haifa in navigation, and Vento, associated also with Sheba, and bought by Medtronic. It's an amazing story. In the midst of a crisis that the world shrinks down, they buy things in Israel. We have also an environment here. We have to mention that because we're living in an environment of wars, here and there, and once in a time, unfortunately. Hopefully that will be the last war. It wasn't the last war. There was already a war after that. We wrote a paper about how an academic medical center has to work under prolonged rocket attack, treat the soldiers, worry about the safety of the patients in the underground location, use high-tech technology to treat our patients. This is a patient with a bleeding carotid used for in 5 minutes you get a CT out of him and you know exactly where to treat him. This is a soldier with shattered chin from a bullet. He's now back to his and speaks everywhere. I mean, he can speak and talk in spite of his shattered chin. In 5 minutes, you get it with this 64 slice, now today it's 280 slice CT. In 5 minutes, you get it and you get the right diagnosis. This is how technology is really helping medicine today. 1 month after the war, Warren Buffett comes to visit Rambam and visit Eitan at Hishkar as well, and he says that he comes to Israel to look for brains, but when he flies over Israel, he is going to look for oil. Now I think he can stop in Haifa to look for oil also. Since then, we built a new fortified emergency room. You all visited to come and visit there, fully computerized, fortified against chemical warfare. At Rambam here, we're building an underground facility that will actually be able to be a regional hospital. We are also building above that clinical facilities, the Rappaport Children's Hospital, the Joseph Fishman Oncology Center, the Biomedical Discovery Tower, and the Cardiovascular Center. These are the plans. We heard some talks about genomes. Whole genome sequencing by next generation technology. I mean, this is a paper in New England Journal of Medicine talking about sequencing one single patient. 2000, 1 million base pair sequencing cost $100,000. In 2010, you could do it for less than $1. What would happen in 2020? Well, with this shrinking economy and where is the world going, it's still a major question. Will whole genome sell for $10? Will $1 be equal to a shekel or to a euro? Many questions to cover. So where are we going? That's the question for the future. Thank you very much.